Welcome to Northern Kentucky Business Works. Today we're here with Dr. Brian Johnson and Dr. Dennis Claus from the Covington Chiropractic and Rehabilitation Center. Welcome.
Thank you.
Thank you very much for joining us.
It's good to be here. Thank you.
Yeah, thank you for having us.
Absolutely. Okay, tell us about the chiropractic business, what it is that you do and how you got into the business.
You want me to start it, John?
Yes.
The Covington Chiropractic office that's open on 200 West Pike, we opened that in August.
Just this August, yes.
Yeah, recently been open. And, we're treating people that are right in our community, treating them through chiropractic and chiropractic adjustments and rehabilitation, just trying to do some things to trying to help them get the health care that they need.
Okay.
You take it from there.
Yeah, that's basically what we're doing. Yeah, we're trying to extend to the community our services. We're here for the community, and we just want to let everybody know where we're located, let them know a little bit about us, who we are, and what we can do and how we can extend our services to them.
Okay. Now, before we get into your backgrounds, I do want to touch base on the restoration of the building that you currently occupy. Let's talk about that a little bit.
Beautiful building.
It's a nice building. It's the entranceway into the railroad station there. It used to be the old entrance way into the station. Mm-hmm. And that's basically what it is. So it has very high ceilings. They're 30-foot ceilings. And we enter from the north side of the building on Pike Street. And our landlord is Mark Tischbein. He's a very nice guy and he's very helpful.
Okay, I heard it's a beautiful building. I haven't actually seen it myself, but I heard the building is beautiful.
It's about 5,500 square foot facility, so we got a lot of room in there.
How old is that over there? Approximately, that building over there. I mean, they're pretty historical.
Yeah, that's pretty historical. I would tell you it's good, at least 100 years anyway.
Wow. And you two, of course, currently run a partnership.
Yes.
At the clinic.
Yes, yeah.
Now I understand there's one more doctor.
Oh yes, there's another doctor that works with us, yes. We try to be here as many hours as we can during the week, yes. Mm-hmm. Yeah. Dr. Thomas Campbell is his name, yes.
Okay. Now let's talk about some of the treatments that you provide to your patients. Some of because I'll be honest with you, I'm not very familiar with the chiropractic industry. So let's say you have a patient come in, excuse me, they've been in an auto accident. How would you treat that patient?
Well, we treat the patient for whatever injuries they've sustained from the accident. Mm-hmm. We'd address them, and then we would do a consultation on it, examine them, take some x-rays if necessary, and then we'd do the rehab on it or the physical therapy on the area that's involved. We work most areas, whether they're shoulders, knees, backs, necks, whatever, we do it.
Mm-hmm. Mm-hmm. I think that's an interesting point right there. A lot of people don't know what chiropractors treat, or if they do know, we figure that we're going to, if you have a headache, you go see a chiropractor, or if your back hurts, you go see a chiropractor. I don't think a lot of people know that we treat the neck pain, the shoulder pain, knees, feet, elbow, carpal tunnel. All of those are things that through adjusting and through the rehabilitation that we offer, we're still able to get the patient out of pain, and more importantly, getting out of pain, getting the structure of the joint back to its original function.
And I'm glad that you mentioned that, because I did want to touch base on dispelling some of the myths about chiropractors, because a lot of people feel that chiropractors only treat back pain, things of that nature. First
of all, you really have to go to how is the body functioning and what controls the body. Your body's controlled by your brain and your central nervous system. And your nervous system is housed between the bony spines that realign your spine. And the nerves branch out to every area of your body. And it goes through your brain, out to the organs, and it gets messages to and from the muscles. So basically, chiropractic treats all musculoskeletal disorders of the body.
Okay. Mm-hmm. Now, we were discussing off camera, considering my condition I am expecting at this moment. Mm-hmm. What kind of, one thing that I suffer from, which a lot of pregnant women suffer from, is lower back pain. Lower back pain and hip pain. Mm-hmm. What are some of the things that you could do to treat someone like me?
Well, of course, we couldn't, adjust you being pregnant the same way that we might adjust somebody else. Mm-hmm. But we modify our adjusting and we modify our rehab to where it still is beneficial for you. We work with realigning the structure of the joint, especially the hips and pelvis and the low back in your case, it sounds like. Mm-hmm. and getting the alignment of the joint to where when you move, the joints aren't grinding or rubbing against each other. It sounds awful just to say it, doesn't it? But that's really what happens. When the joints are misaligned. It's almost like two gears in a car that are misaligned. And yeah, what happens to the gears in the car if they're misaligned? Well, they're going to grind and they're going to wear down. And same thing happens in your spine. Now, as we realign the structure of the pelvis and the low back and the rest of your spine, get the joints moving like it's supposed to, it takes the irritation and the compression off of the nerves. There's no more nerve irritation or compression. The muscles are able to relax naturally, and function is restored.
So how does that work in regards to circulation, things like that? How does that relate in regards to the increased circulation in your body with the adjustment of the muscle?
When you're pregnant right now, the body releases more chemicals, more estrogen, and it's flowing through the blood to supply the baby. And what happens is the fluid also allows your pelvis to expand, actually, so the baby can go through the canal. So the joints actually get more mobile and they move a lot more because you have more fluid down there to help push the baby along through the canal. So basically, when they are moving like that, then you have an opportunity for the joints to come out of proper alignment, and when they come out of proper alignment, they pinch the nerves, and it affects the muscles that the nerves go to, and it causes aggravation, and we correct that misalignment.
Sounds interesting. Very interesting. What are the age range, or let me rephrase the question, in regards to the ages of your patients? What would be the youngest patient that you would treat, and also the oldest patient that you would treat?
The youngest patient that I ever adjusted was 1 day old. And of course, again, it's not like I might adjust Dr. Johnson or he would adjust. It's not the exact same way. It's very light, very fingertip adjusting. But one of the first traumas that you'll go through is the birthing trauma.
Right.
And correcting the spine after that. I mean, it's very important for the development of the child.
Two things that are associated with that are the bones being so fragile when you're very, very young, and of course when you're very, very old. Do you have a lot of elderly patients coming to visit you? And if so, would there ever be a time to where you would tell someone, I think you may be at an advanced stage, and perhaps, or maybe this, may not be the best fit for you?
You modify your technique to basically everybody. When the child's young, there's a lot of cartilage there. It doesn't take much to move. Sometimes just stroking the spine is very effective. As the patient gets older and they become in a geriatric or in an elderly form, basically the bones become brittle, and sometimes there's not enough calcium, and you'd modify your technique. You wouldn't be as rough with them, knowing that their body can only take so much. But the object here is to properly realign the spine so that you have proper nerve flow throughout the body, so it would basically unmask any pain that you have, so you would be free of pain. And then we correct it and we stabilize it, prevent it from ever coming back.
Okay. And that's, you only treat physically. Do you ever prescribe medication in addition to your treatments?
No, we don't. As chiropractors, our healing that we do is just with our hands and with our rehabilitation that we learned, and just like Dr. Johnson said, the experience that we have in treating people is what is another facet of it that helps us allow to get people better.
Okay, sounds great. Now, have either of you ever been treated by a chiropractor?
Oh, yeah, all the
absolutely.
time. I mean, it's a way of life. Yeah, I mean, you practice what you preach.
Surgery should always be a last resort.
Yeah.
Chiropractic first, pills second, and surgery last. And that's kind of the pecking order as far as our health is concerned.
Absolutely. We're going to close. Why don't we go ahead and give everyone your contact information in case they want to reach you?
Please. Brian Johnson, the telephone number at the office, it's Covington Chiropractic and Rehabilitation Center, area code 859-360-6488.
Thank you very much for joining us.
Sure. It was a pleasure to be here.
Okay, well, you're watching Northern Kentucky Business Works. We thank you very much for joining us.